introduce Dr. Lisa DelBuono. I have to say, there's a YouTube video, I'm going to put it in the chat, that she did, and it is amazing. It's 11 minutes, and she just kind of goes through carbon pricing using EnROADS, and she really tackles these complex concepts in a just really simple way. So that was one of my very first encounters with her, is through her video. I watched it probably 100 times because I loved her phrasing, and it's just a really great video, and I would recommend anybody who's getting into this to watch it. And sometimes I'll just watch it now and then just to, how did she say this? She's incredibly accomplished. She's a founder and executive director of Michigan Clinicians for Climate Action. She leads the CCL Health Action Team. She's a state liaison coordinator for Citizens Climate Lobby in Michigan, and she's a physician, a diagnostic pathologist trained at the University of Michigan. And with that, I'm going to stop sharing my screen, and then I'm going to let Lisa take it from here. Thank you, Lisa.
Oh, thank you, Laura. And that was a very gracious introduction. And I should say I'm no longer a state coordinator. And I will tell you that I did 2 videos, one for progressives and one for conservatives. So whichever resonates better with you, the progressive one's a little bit longer. But that's really, I was honored to be asked to be here, and I appreciate each of you for being here. And I hope that this is just an interesting and curious way to maybe use EnROADS in a slightly different way. When Laura and I talked about this, she suggested that maybe I approach it from the point of view of, well, what if you were at a library and you wanted to do a presentation to the general public, and you were going to use EnROADS to talk about health. And so that's what I'm going to, try to give you an example of how I might do it. And maybe together we can think of even better ways to do it. So, I'm going to go through just some real brief stuff about the health impacts of burning fossil fuels. I know that you all know that, but it kind of sets the stage a little bit for what I want to talk about or how I want to use EnROADS. In my little simple way of thinking about burning fossil fuels and health, I put the health impacts into 2 buckets. One is the air pollution bucket, which is basically contaminants in the air that are not naturally occurring. They have local impact. And importantly, they fall out of the atmosphere when you stop burning fossil fuels very quickly. And why I emphasize that is people who are getting sick from the air pollution located close to fossil fuel power plants, et cetera, will actually see health co-benefits very quickly, like in a matter of days or weeks or years, but it won't take long for them to see the benefits of cleaning up that air. And that contrasts with the climate impacts, which are really related to greenhouse gas emissions, which we're all very familiar with, have a global impact, are naturally occurring substances. And as we stop burning fossil fuels, we'll have to see them come back into reestablishing a natural equilibrium, and that's going to take longer. So I want to emphasize that, people are dying every year, like millions of people are dying every year and have been for decades due to air pollution. If you look at both indoor and outdoor air pollution in 2021, globally, we're talking about 9 million deaths, 8.7 to be exact. And the total COVID deaths since 2020 till now are 6.8 million. So every year we're seeing more than that die from air pollution. And when we think about these greenhouse gases and climate impacts, the CDC put together a really nice chart that I often use when I'm talking about climate impacts. We're not going to go into a lot of details. Suffice it to say, climate change impacts many aspects of our health, maybe all aspects of our health. And the way I often think about it is that it acts as a threat multiplier, often taking common medical illnesses and that may be managed well and exacerbating them, sometimes exacerbating them into a medical emergency. A simple example would be a 70-year-old woman who maybe had part of her lung removed because of cancer, but was doing well for over a year, was at home, used home oxygen, which requires an electric outlet to function. And she had an extreme weather event in her area, and a large area of the town had an outage. And guess what? She ends up running out of oxygen overnight and presenting to the ER. So that's the idea of a threat multiplier. And I think many of our climate impacts on health are actually that. But what I want to focus on here, and when I'm thinking about EnROADS, is how can we talk about this in terms of climate solutions? And really, climate solutions, if you don't take any other point home, is that climate solutions are health solutions. And so what do I mean by that? Well, the Lancet Commission on Climate and Health, and they're probably the most well-established medical authority on climate and health in the US, says that climate change is the greatest public health threat of the 21st century, but also the greatest health opportunity. And so why would that be? Well, it's simple. Much of what we do to address the climate crisis is also good for our health, whether we're talking about, being more active, walking or biking to work or to play, eating less meat, driving electric vehicles, not idling our cars. All of these things are good for the climate and good for our health. But if we really want to see, to address climate change, we need collective action, right? And in order to have collective action, we need policies in place that make the easy choice, the healthy choice, and the environmentally friendly choice. So this is where I think we can use EnROADS, finally get there. So do we have an example of a climate solution that's also a health solution? Well, we've been talking a lot about electrifying our transportation system. So why don't we start there? Let's see. And so I'm going to just pop over to the EnROADS site. And I think all of you are familiar with this site. Probably on the left-hand side, we're looking at our energy supply, the area under the curve, basically coal, oil, natural gas between 2000 and 2100, our net greenhouse gas emissions, our average global temperature increase at 2100 using a middle of the road scenario. We know this is a global model, just to reiterate the things that I'm sure all of you are aware of. And if we look at the transportation sector and we think about electrifying our transportation sector, how do we talk about that? How can we really look at that? And just to reiterate what probably you guys already know, is we hit those three little dots and it gives us a lot of information. If you even want more information, you hit the little I there and you can pop it out so everybody can read. So let's pop it out so everybody can read and say, okay, what are we doing when we're electrifying? And, we're talking about investments in electric vehicles and research and development, battery formation, etc. So that's essentially what it means to electrify the transportation system. And what I want to do is go back to the EnROADS and take a closer look at, well, what does this mean? And what does this mean in terms of health? So let's first electrify, and we're just going to say we have a magic wand, we can really just push it out really quickly and go as far to that lever to the right as possible. And we see that we do get, by the end of the century, a net decrease in greenhouse gas emissions, maybe not as much as you would think it would be, but you do see a decrease. But what I want to look at now is, if we go down here to the impacts, what is the impacts of electrifying on air pollution? Well, we can look at this little impacts button here with a caret, and we see air pollution from energy. And what they're looking at specifically is that fine particulate matter. Air pollution can be divided into fine particulate matter, ground level ozone, other things as well, but those are the two big ones that people talk about. And look what happens when we electrify. We don't decrease, we don't clean up our air pollution like we thought we would. It actually increases, right? So why would that be? Well, I bet most of you already know the answers to that, but we can answer that using EnROADS in a couple different ways.
That would be tempting fate.
So if we
I answered the
change
word, but
our
you can't
global sources of primary energy, and I think it's a little bit easier to see this view of it. And we go back and forth from the scenario before, what's changing in our energy mix? Well, to my eye, the obvious thing is that this red line is going down, right? So that's our oil, and that makes sense. If we're not putting gas in our car, the amount of oil would go down. What might not be as obvious is that the brown line here, the coal, has actually gone up. And so we can look at that more carefully if we go, again, up here to global sources of primary energy, and then go to primary energy demand. And we look right there at primary energy demand and look at what we see. Coal increases and air pollution increases in parallel, almost exactly. So the take-home message, I think, from looking at that, this part of the EnROADS presentation, or using EnROADS to talk about electrification, is that, well, you know, electrification is good. Electric engines are clearly more efficient than an internal combustion engine. But if we really want the health co-benefits of cleaning up the air, then we also need to decarbonize our electric grid, or get that CO2, get that coal out of that electric grid. And I think EnROADS really shows that nicely. Otherwise, we're going to still have a lot of air pollution. Actually, it will get worse. And to just bring home air pollution a little bit more, again, it's a form of secondhand smoke. And the closer you are to that source of the smoke, or the other fossil fuel pollution, the more health impacts you're going to see, the worse the air quality is. And most of us probably think about how it affects the respiratory tract. We're not surprised that asthma gets worse. We know that it's really reached epidemic proportions, especially among people living in urban areas close to fossil fuel pollution. What we may not realize is that it contributes to about 1 in 5 deaths worldwide, which I already mentioned, but it still contributes to about 1 to 10 or 20 deaths in the US. And the reason why the US experiences less is because of the Clean Air Act. So we really want to protect and support that. But in addition to that, it's correlated, this fine particulate matter is correlated also with an increased incidence in cognitive difficulties, that's memory difficulties in the elderly, an increased incidence in preterm deliveries, low birth weight, and stillbirths in the US. And if you're unfortunate enough to get infected by COVID and live in an area where there's worse fine particulate matter, you're more likely to die from it. Nearly 4 in 10 people live in counties where levels of air pollution is still dangerous, according to the American Lung Association, and people of color are disproportionately impacted. Black people experience breathe polluted air 3 times more commonly, and Black people die from asthma 5 times more likely. I borrowed this slide from Dana. But basically, if we electrify and we don't change our energy mix, we're going to be using more coal. This shows the increased amount of coal that we would be using if we don't change our energy mix. And what's keeping us, one thing that's keeping us from changing our energy mix is transmission infrastructure. Basically, building out the transmission lines. And that's why CCL has as one of its major policy agendas, permitting reform. And I think that Peter Dugas is going to get into permitting reform in more detail, so I'm going to pass over that, but I wanted to make that connection between air quality, health, electrification, and the need for permitting reform. Another solution or example of a climate solution that's also a health solution would be walking or biking to work. So how do we model walking or biking to work? Well, if we go back here to our EnROADS and we click on our little thing, we can go right over and open up EnROADS again, and we're going to be back at ground zero. All of our levels are at ground zero. And the way we model that is we look at energy efficiency for transportation in particular. And if we go to those three little dots, there are a couple things that I really want to point out under this I, with this information tab, and I'm going to blow that up. So what it's talking about when they're talking about energy efficiency is that we're talking about walking and biking and using public transportation and reducing our flying and telecommuting, etc. But the other thing that I wanted to point out is that there's health co-benefits from this, improved air quality. And at the bottom of this section are a couple case reports that I think you guys might be interested in. Bike-friendly cities should be designed for everyone. So this gets at the equity issue, the fact that in the inner city, if you ever look at the maps, the interstates tend to, be most numerous, most dense there, and it's really hard to walk or bike in many cities, and that's an equity issue. And then the cost effectiveness from the health co-benefits from increasing walking and biking is outlined in this article here. So I really wanted to draw your attention to that. And then we'll go back to EnROADS and model it like I promised you I would. So if we go back over here to energy efficiency, what is going to happen? What I really would like you to look at when I slide this lever to the right is I want you to look at this area right here, the energy that we're using, and watch and see what happens. We need less energy if more of us are walking and biking to work, and we will see a decrease in our emissions. And if we look at air pollution again, what we see is actually, in this instance, it goes down because we need less energy overall. Again, if you look at the CO2 levels, it's almost identical, and I could do that. I just wanted trying to save time a little bit here, but we'll look at it real quickly. So that's another climate solution, which is also a health solution. But we're not done yet. We got more of them. So let's keep moving. What's another example? And you could post this to the audience, but for the sake of time, I'm moving quickly. So what about building electrification and energy efficiency, essentially retrofitting our homes and building new homes that are more electrified and have more insulation? Well, we certainly know that if we build our homes in a more energy efficient way, we'll lose less heat, and that'll be good from climate points of view. But if you actually talk to the people like in downtown Detroit, they'll tell you that part of what's also happening is that their old homes are so dilapidated, so poorly insulated, that air quality is much almost identical inside and outside of the house. Now, I don't know that that's been measured scientifically. That might be more anecdotal or fear, but certainly shoring things up improves the quality of air indoors, in part because you're not having such breathable homes in a negative way. Also, as we move away from gas stoves and electrify in a whole variety of ways in our home, we will improve indoor air quality, as well as using heat pumps, etc. So indoor air quality improves as we electrify. So that's what happens in terms of decarbonizing our homes. But I do also want to bring home the fact that our industries, importantly, need to decarbonize. And one big important industry that needs to do it is healthcare. If healthcare were its own country, it would be the 5th biggest emitter. And the US healthcare is about 8.5% of US emissions. And in that regard, we had at the UN COP in Glasgow, so the one before last, the US committed to decarbonizing the healthcare sector and implementing carbon smart policies. And President Biden has put out through Health and Human Services a voluntary pledge to decarbonize health. Actually, that pledge is closed, but many of us have petitioned to reopen it. And that's an area where you might want to partner with your colleagues who are other fellow CCLers, who are health professionals, who are working with their hospital systems to decarbonize. So let's go over here and model that. Let's model what we're doing when we're improving energy efficiency and decarbonizing or electrifying our building and energy sectors. Okay, let's think about what happened when we improved energy efficiency in our transportation system. We saw that the amount of energy went down. So let's just look at that. There, it goes down, right? Okay, what happens if we do it with our building sector? Look at this. It goes down even more. And then if we electrify, again, we'll see the temperatures in that greenhouse gases go down. We can go and we can, look at air pollution again. And as we probably expect, it also comes down. So this is another combination of things which is really good. It improves human health because you're improving indoor air quality along with outdoor air quality, and it's a win-win. Now, what I'd like to do is go back to the PowerPoint if I can figure out how to do it, but here we go. Let's see if it keeps moving. Yeah. So we're almost done with climate solutions that are health solutions, or health solutions that are climate solutions, but I want to model this one as well. We certainly know that our diet that's based in meat is not healthy. And if we were to eat a more vegetarian based diet and eat less meat, and if we followed what the Lancet suggests and we reduce our meat consumption to being very rare, like only on holidays, this is how Climate Interactive tells us we would simulate it. We could expect, because we were decreasing the demand on animals, that we would actually see a decrease in methane and nitrous oxide because we have less animals, especially belching animals, less manure, we need less fertilizer, and importantly, we need to grow less grains to feed the livestock. So they suggest that, and I'll show you how this is done, we could decrease the lever by about 20%. And then they also say we have less need to do processing and the machinery necessary to process the meat and transport the meat. So our energy efficiency would increase by about 1.5%. And then we frequently lose our forests so that we have land to grow the crops for the livestock and for the animals to graze. So our deforestation would decrease by 1.5%. So we're going to model that. And I actually cheated here and went ahead and modeled it. I think I did. Yeah, I did. So that we didn't have to spend a lot of time doing that on our own. But the first one was right here. If you hit the 3 dots under methane, and I actually made a mistake. This was supposed to be 20%. So your methane and other gases would decrease 20% is what they estimate if you're on, quote, the Lancet diet. And then again, the second thing to do was improved energy efficiency, because you're not transporting or processing the meat anymore. And so that's up 1.5%. And then the third component to it, they suggest, is decreasing your deforestation, so minus 1.5%. And that's how you would model eating less meat. So eating less meat is good for our health and it's good for the climate. Last one. The last one comes from afforestation. we know that trees are good for our health. They're good for our health because they're good for our mental health, our spiritual health. This photo my husband took and actually put on Facebook as being one of his happiest days. But this is what I really want to focus, and this is urban tree forest. And what we know is that heat kills. Our newborns, our pregnant moms are really vulnerable to heat, and the unborn is vulnerable to heat. We lose young athletes every year, and the elderly, especially if they're in inner city and they don't have access to air conditioning. And even if we go back to historically redline communities, which you see right here, this is where the mortgage was only given to people starting in the 1930s. Based on color, they allowed people to have mortgages in undesirable areas versus desirable areas. So redlining was where the undesirable areas. And if you look at the tree canopy and the green space, it's more prevalent on the periphery where it's blue and green communities. And the reason why I bring this up when we're talking about forestry, we're talking about building this out into the inner cities. And why it's so important is when you look at the amount of asphalt and hard surfaces in the inner city, these things hang on to the heat at nighttime. They do not cool down. That's the urban heat island effect. People inside the cities really suffer more. And when you have an extreme heat event, many more people die when they're in an area where they cannot cool down like that. Last thing about heat is that ozone, which is another type, ground level ozone, which is another air pollutant, tends to go up as temperature goes up, so our air quality gets worse. So if we were to essentially do that on EnROADS, it's relatively simple. You can look at the 3 dots and read how you do it. But let's say we were able to build out as much as possible with our forest everywhere. And obviously land is going to be a big problem, and we may not be able to do it as much as we would like. We would see emissions reductions, but it wouldn't be a tremendous amount. It is important. And then another key point is that it takes a while for the trees to grow. But this is how you model essentially building out forests, which is another example of good for your health and good for your and good for the climate. Now, one last point, and that is this. Here is what it looks like if you put all of these together. We're at 2.6 degrees, and I'm gonna click on that real quickly, and then I'm going to go back. We're going to look at that in just 1 second, but keep that in your head. And then, of course, you guys are CCLers. Here's a key question. What is the best climate solution for health? I bet any one of you could answer that in a heartbeat, right? A steadily increasing economy-wide price on carbon. And if we were to model this, I bet all of you know how to model it. You go right over here to EnROADS, and we model it. And I want to remember that we were at 2.6 with all those individual things. We're at 2.4 degrees with a price on carbon, like the Energy Innovation Act, starts low, goes high. And the other thing that I really want you to look at is air pollution again. So let's go over here to impacts one more time. Let's look at air pollution from energy, and then let's compare it to air pollution from that we were looking at before. And this is the scenario at 2.6 degrees. And let's look at air pollution right here. Okay, so let's look at it critically and carefully. Air pollution with all these individual points starts going down at about 2040, right? And it gets to a level of about 15, what are they, megatons per year. Now let's compare it with a price on carbon and just a price on carbon. You see it starts going down right away, and it goes down much further. And according to the Columbia study looking at the Energy Innovation Act, we would see a 95% decrease in I'll just say in the building blocks of burning fossil fuels. So when we're talking about climate solutions or health solutions, you can speak very, very comfortably about a price on carbon. Bring home points using Dana's slides. This is where we need to be. This is where we are. And this is where we'll be thanks to the IRA without permitting reform. Without permitting reform. We add permitting reform. Here we are at 40%. Add that carbon price, we can get down to 52%. Healthy forests, building electricity and efficiency. All of these things are good for our health and good for our climate. And as we round out, I want to bring home this paper by Dr. Drew Shandell that looked at the health benefits of addressing the climate crisis over the next 50 years, avoids 4.5 million premature deaths, 3.5, I think there should be 1 million there, hospitalizations and ER visits, 300 million lost workdays, and $700 billion in health co-benefits. And this link we were just dropping in, and I just want to show it to you. It's super cool if you guys like to get deal with kind of gadgets. This is an interactive map, and you can look at your own city, and you can dial in a whole bunch of parameters and look at the number of deaths or hospitalizations or a whole host of other things. So I hope I convinced you that climate solutions are health solutions and that we can use EnROADS to really bring home that point. There you go.
Thank you, Lisa. That was really great. And what a great example. I mean, who doesn't care about health? And really a great way to talk about climate change in this context of health. And that's what we want us to get really creative on how we're using EnROADS as kind of our platform and foundation, but then really talk about things people really care about, and we can talk about these solutions. So that's, I think you nailed it. You got the bullseye once again.